I make space for my daughter first. I make space every day for my animals who I dearly love. I'm Vicki. I'm 74 years old. I'm retired, but I work 2 jobs. I've got a multitude of animals at home that fill my life and a beautiful daughter. I've always been the keeper of everyone. When my mother passed, I said, Mom, don't worry about a thing. I've got the family. I'll take care of them. And that was my goal. Now it's my turn. I'm going to take care of me. That's where I am right now. My main doctor, my primary doctor, kept watching a nodule in my lung, but he never went as far to get a CAT scan. So then they thought I had a blood clot in my leg. So they did a CAT scan and found out it was a malignant tumor. I think I was in kind of a fog. They did a biopsy, found out it was something that they couldn't remove. The conversation was real clouded. You know, I wasn't grasping what he was saying. The next meeting, I was better, because then he said, okay, we're going to do chemo, radiation, and the therapy. And very emotional, still emotional. So, but I'm real headstrong, and I had to be strong for my family.
Imfinzi, durvalumab, is a prescription medicine used to treat adults with a type of lung cancer called non-small cell lung cancer, NSCLC. Imfinzi may be used when your NSCLC has not spread outside your chest, cannot be removed by surgery, and has responded or stabilized with initial treatment with chemotherapy that contains platinum, given at the same time as radiation therapy.
With using the drug Imfinzi, my daughter was more concerned because I think during that time, being so far within the treatments, like the chemo, the radiation, and then starting Imfinzi once a month. But she said, Mom, it's all for a good cause. You got to keep going forward. So I'm just going to go for it. And the nurses there, they were so supportive of me. They just make you feel family. I keep going back to the same word. It was my safe zone. I think people need to not feel sorry for themselves, which is hard to do because I know I did it. Because it's the why me thing. First of all, find a doctor that they believed in or they felt safe with. I think that's one of the biggest things. But you gotta have faith in your doctor. I got a little house, got a wonderful family, love my pets, and a good doctor. I don't think much about cancer. I'm living my life day to day. I'm happy with who I am, where I am, who I'm with, what I can give.
Important safety information. What is the most important information I should know about Imfinzi, durvalumab? Imfinzi is a medicine that may treat certain cancers by working with your immune system. Imfinzi can cause your immune system to attack normal organs and tissues in any area of your body and can affect the way they work. These problems can sometimes become severe or life-threatening and can lead to death. You can have more than one of these problems at the same time. These problems may happen anytime during treatment or even after your treatment has ended. Call or see your healthcare provider right away if you develop any new or worsening signs or symptoms, including lung problems, cough, shortness of breath, and chest pain, intestinal problems, diarrhea, loose stools, or more frequent bowel movements than usual, stools that are black, tarry, sticky, or have blood or mucus, and severe stomach area, abdomen, pain, or tenderness. Liver problems, yellowing of your skin or the whites of your eyes, severe nausea or vomiting, pain on the right side of your stomach area, abdomen, dark urine, tea-colored, and bleeding or bruising more easily than normal. Hormone gland problems, headaches that will not go away or unusual headaches, eye sensitivity to light, eye problems, rapid heartbeat, increased sweating, extreme tiredness, weight gain or weight loss, feeling more hungry or thirsty than usual, urinating more often than usual, hair loss, feeling cold, constipation, your voice gets deeper, dizziness or fainting, and changes in mood or behavior, such as decreased sex drive, irritability, or forgetfulness. Kidney problems, decrease in your amount of urine, blood in your urine, swelling of your ankles, and loss of appetite. Skin problems, rash, itching, skin blistering or peeling, painful sores or ulcers in mouth or nose, throat or genital area, fever or flu-like symptoms, and swollen lymph nodes. Pancreas problems, pain in your upper stomach area, abdomen, severe nausea or vomiting, and loss of appetite. Problems can also happen in other organs and tissues. These are not all of the signs and symptoms of immune system problems that can happen with Imfinzi. Call or see your healthcare provider right away for any new or worsening signs or symptoms, which may include chest pain, irregular heartbeats, shortness of breath or swelling of ankles, confusion, sleepiness, memory problems, changes in mood or behavior, stiff neck, balance problems, tingling, numbness or weakness of the arms or legs, double vision, blurry vision, sensitivity to light, eye pain, changes in eyesight, persistent or severe muscle pain or weakness, muscle cramps, joint pain, joint stiffness or swelling, and low red blood cells and bruising. Infusion reactions that can sometimes be severe or life-threatening. Signs and symptoms of infusion reactions may include chills or shaking, itching or rash, flushing, shortness of breath or wheezing, dizziness, feel like passing out, fever, and back or neck pain. Rejection of a transplanted organ or tissue. Your healthcare provider should tell you what signs and symptoms you should report and monitor you depending on the type of organ or tissue transplant that you have had. Complications, including graft versus host disease, GVHD, in people who have received a bone marrow stem cell transplant that uses donor stem cells, allogeneic. These complications can be serious and can lead to death. These complications may happen if you underwent transplantation either before or after being treated with Imfinzi. Your healthcare provider will monitor you for these complications. Getting medical treatment right away may help keep these problems from becoming more serious. Your healthcare provider will check you for these problems during your treatment with Imfinzi. Your healthcare provider may treat you with corticosteroid or hormone replacement medicines. Your healthcare provider may also need to delay or completely stop treatment with Imfinzi if you have severe side effects. Before you receive Imfinzi, tell your healthcare provider about all of your medical conditions, including if you have immune system problems, such as Crohn's disease, ulcerative colitis, or lupus, have received an organ or tissue transplant, including corneal transplant, have received or plan to receive a stem cell transplant that uses donor stem cells, allogeneic, have received radiation treatment to your chest area, have a condition that affects your nervous system, such as myasthenia gravis or Guillain-Barré syndrome, are pregnant or plan to become pregnant. Imfinzi can harm your unborn baby. Females who are able to become pregnant. Your healthcare provider will give you a pregnancy test before you start treatment with Imfinzi. You should use an effective method of birth control during your treatment and for 3 months after the last dose of Imfinzi. Talk to your healthcare provider about birth control methods that you can use during this time. Tell your healthcare provider right away if you become pregnant or think you may be pregnant during treatment with Imfinzi. Are breastfeeding or plan to breastfeed. It is not known if Imfinzi passes into your breast milk. Do not breastfeed during treatment and for 3 months after the last dose of Imfinzi. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of Imfinzi? Imfinzi can cause serious side effects. See above. The most common side effects of Imfinzi when used alone in adults with non-small cell lung cancer, NSCLC, that cannot be removed by surgery include cough, feeling tired, inflammation in the lungs, upper respiratory tract infections, shortness of breath, and rash. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of Imfinzi. Ask your healthcare provider or pharmacist for more information. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of AstraZeneca prescription drugs by calling 1-800-236-9933. If you prefer to report these to the FDA, call 1-800-FDA-1088. What is Imfinzi? Imfinzi is a prescription medicine used to treat adults with a type of lung cancer called non-small cell lung cancer, NSCLC. Imfinzi may be used when your NSCLC has not spread outside your chest, cannot be removed by surgery, and has responded or stabilized with initial treatment with chemotherapy that contains platinum, given at the same time as radiation therapy. It is not known if Imfinzi is safe and effective in children. Please see full prescribing information, including patient information, medication guide for Imfinzi, at imfinzi.com.